Ladies and gentlemen, welcome to It's Rainmaking time. It is extremely exciting. We have one of the few people on Earth today who is curing cancer across the world. It's not a joke. It's not some alternative hyped-out therapy. It's Dr. Tullio Simoncini, a Roman doctor specializing in oncology, diabetology, and metabolic disorders. He is the author of the book Cancer Is A Fungus. He gets it done with many different types of cancers using sodium bicarbonate. He's going to explain to us how he uses it, what he does, and what's available to us, God forbid, that have cancer today. Cancer is curable. Ladies and gentlemen, Dr. Tullio Simoncini, welcome to It's Rainmaking time.
Thank you to you. I am glad to respond to your questions and to clarify to your to the American people my theory and my treatment.
First of all, I think it's extremely courageous of you what you're doing. It's unique. There are a lot of people on the earth saying that they're curing cancer or that their treatments will cure cancer. But the truth really is in the results, isn't it?
Yes, it is true. Because, in my opinion, if you want to make a research for something, you have to have a logical idea. So everybody wants to cure cancer without ideas. Look, the official oncology investigated an hypothesis, the hypothesis of the abnormal cell reproduction, and after hundreds of years of researches, it is still at the starting point. So it is a false idea, because if you don't find anything in 1 century, maybe the main idea is wrong. The other care, alternative people, alternative doctors, alternative carers, they have no ideas. They just say, oh, this herb is good because eliminate the cancer, without results. They have no result, but they say that. Or this herb, this seed, or this wave, this vitamin, this supplement. They just deceive people because they have no idea, they have no results, they just want to sell products without helping anybody. This is my opinion.
This is very controversial of you to say this, and it kind of puts you in the midst of conflict between alternative practitioners and allopathic doctors who are also not getting results by providing chemotherapy and radiation. Now, why is it, doctor, that a certain percentage, I don't know how small it is, but a certain percentage of people with cancer who use radiation and chemotherapy somehow will go into remission? Why does that happen?
Because there is a 1-2% that heal for hazard. No matter if they do the conventional, the seeds, the waves, everything. But the real cancer, such as brain, lung, pancreatic, liver cancer, there are no survivors. Why? Because they are true cancers. When do we have remissions with conventional treatments? Sometimes with the surgery, but it's very rare that the surgery can uproot completely the fungal colony. But it can happen in a certain percentage, 3-4%, 2, 3, 4. Then all the other healings are just lies, manipulation, manipulation of the statistics, lies. So, for instance, look at the cancer of the breast. Oh, the official oncology says, oh, we have many remissions. That's not true. In Italy, we had 40 years ago, 13 women died from cancer. Last year, 13 women died from cancer. Where is the difference? The difference is that they make lots of false diagnoses that are not tumors, and so the people heal, patients heal, but they are not true. Another case, another cancer that is a flag for the conventional oncology is the lymphomas. Many lymphomas can heal in the official oncology and in alternative treatments because they are not cancer. The immune system can grow up for many other causes, but some also for the cancer, but not always is cancer. So the healings in the conventional treatments are just the result of a manipulation, lies, manipulation of statistics and hazard. Because if we don't know what is the cause of something, of a cancer, how can we be sure that what we do is correct, is effective? This is just a dream, but it is not true, just manipulation, propaganda.
So
that's my opinion.
So, doctor, what you're saying, in other words, is most of the people that are treating cancer absolutely don't understand what they're dealing with, what they're looking at, or how to proceed.
Right. Because if we speak about the population of the constellation of Andromeda, or I don't know, of a star billions of kilometers from the Earth, and we speak and we can say whatever we want, but we don't know what we deal with. We don't know we don't know what to say because we don't understand what kind of people of living beings are in the opposite part of the universe. So if I am an humble countryman, I can just say, oh, I don't know. If you are a big scientist, a big researcher, you can make complicated, difficult theories, but you say stupidities because you don't know the subject of the investigation of the theories of the researches. So I can say definitely today the scientists don't know what they say and what they do. They just they are wandering in the dark. This is my opinion, and the result is that with these theories, with these hypotheses, we have 9 million people dying every year from cancer. So it is evident, the lie.
There was a very famous statistician named Dr. Edward Deming that traveled around. By the way, he spent extensive time in Japan introducing people to his theory about quality. I studied with him. And one of the things that he said years ago, he mostly helped people with manufacturing. But what he said was, no matter what you do in the area of quality, a certain statistical portion of all products, no matter how good you are, is going to go back. When you were talking about statistically, there will be some people who will take to radiation and chemo simply because there's a statistic of people that no matter what they take, they're going to heal. Like an anomaly. It's almost like a medical anomaly.
Yeah, but that's no, because we have the hazard, and no matter what you do, you will find always some people that can heal by themselves.
Right.
That's the problem. Without any idea, without any effective treatment, without nothing. So this is not science. This is just, I don't know, a deal of betting.
Right. I'm just saying statistically, there will be a certain percentage of people that will heal no matter what.